stage labor complications, apart from postpartum hemorrhage, peripartum hemorrhage, there is a common entity which is known as retained placenta. So when do we call retained placenta? If placenta is not delivering even after 30 minutes. So when placenta is not delivering after 30 minutes, there are two options that you can go for. The first option is always controlled cord traction and delivered placenta by controlled cord traction if not already attempted. So you gently, you see the uterus is contracting, you push your hand on fundus, push it upwards and give a gentle traction on the cord. 75 to 85% of the times, this method will deliver your retained placenta. Now what if it is not being delivered by controlled cord traction? Then you attempt a manual removal of placenta. For manual removal of placenta, you always do it in OT under anesthesia with complete asepsis and antiseptic protocols to be maintained, wearing a long glove. And what you do is, you follow this cord which is lying outside, insert your hand in a cone shaped manner through the cord. So once you are inside the uterus where you see where the margin of the placenta is lying, now you put this hand on the abdomen to guide yourself, because you may perforate either laterally or superiorly, because the myometrium is very thin and maybe the uterus is not very much good in contraction. After you have done this, you find the placental margin and you try to slice using a slicing movement like this. You try to separate the placenta. So once you have separated the placenta entirely and you are sure that the placenta has come out from all the circumferential margin, then only you bring the cord outside and deliver the placenta outside. So you don't try to deliver that you have separated the placenta from one side and then now you can just pull it out. It should not be done. It will lead to two complications. One, the placenta will be left behind, the cord will be disrupted, and there may be you trying inversion if there is focal adhesion of placenta. So after you have taken out the placenta, your hand is still inside the uterus, you check for sexcenturate loops or retained cotyledons. Sometimes there is focal adhesion of placenta also. So when you are sure, and you give uterotonic in higher doses so that uterus is contracted, and after you doubly check for the entirety of the placenta whether it has been delivered completely or not. And then you give an antibiotic that should be broad spectrum to prevent the sepsis associated with manual removal of placenta.